Now moving on to the next MCQ, baroreceptors are activated by. So we all know that baroreceptor is basically stretch receptors, right? So it is present in two very important areas. That is the carotid sinus and the aortic arch. So the baroreceptors, they are present in two main areas, that is the carotid sinus and the aortic arch. Why? Because carotid sinus, if you see, it is present at the bifurcation of the common carotid artery. That is right before the blood enters the brain. Okay, and the aortic arch, if you see, it is present in the heart where the blood, after pumping, it enters the body. So right before pumping of the blood and right before the blood reaches the brain, the two main areas in the body, the baroreceptors are present. These are basically stretch receptors. So carotid sinus is supplied by glossopharyngeal and aortic arch by vagus nerve. So what happens when the body experiences vasoconstriction? This constriction of the blood vessels. Baroreceptor starts firing. So what happens is the signals or the baroreceptor starts firing when there is vasoconstriction, and the signals are sent to the brain via nucleus of tractus solitarius. And what happens? The brain, it controls by increasing the parasympathetic activity and decreasing the sympathetic activity. So in that way, the BP is going to get reduced. So again, in vice versa, when there is increased vasodilation, the body signals again to the brain, there's going to be decreased parasympathetic and increased sympathetic activity. This is what the function of the baroreceptors. So baroreceptors basically controls the blood pressure, and it is present in two main areas, that is the carotid sinus and the aortic arch. So this is a very simple, straightforward question. See, again, I'm telling you, don't ever make mistake or don't ever consume time in a straightforward factual questions, because see, baroreceptors is activated by blood pressure. I am sure 90% of the times students will answer this, unless and otherwise you are underprepared or didn't even touch the book. You are not going to miss this out. So baroreceptors is basically activated by blood pressure. We all know that. If you make mistake in this, you will be at least pushed to 3000 to 4000 ranks behind. Again, you have to compensate that with a difficult question where those 3000 4000 rank students missed it. Okay, so never miss a factual question, never consume your time in factual question, because factual questions and one line questions are like, or lucky numbers, because you are going to get more amount of case scenarios only these in these kind of situations. Nowadays, lots and lots of case scenarios, time consuming, 5 lines, 6 lines. So you spend your time there. When a straightforward question comes, mark it, go to the next question. Never mark the question for review. If I'm very confident about blood pressure, I should never mark it for review, because that is blood pressure answer. So if you mark that for review, at the if you come at the last, you spend 1 second or 2 seconds, that's total waste of time. So be confident and straightforward factual questions, you should mark it as fast as possible. And if you're confident, don't mark the question for review. Okay, next question. So which antigen is present in all the groups of ABO? It's a very interesting question. Okay, see, we have A, B antigen, two very important antigens. So basically, antigen is a glycoprotein which is present in the RBCs, and depending upon the presence, we are going to tell the patient what blood group they are having. So if A antigen is present, A group. If B antigen is present, B group. If A and B are present, O group. Now a very important question is, there is something called as H antigen. Okay, H antigen is a precursor of A and B antigen. So am I right in saying that H antigen will be present in A group patients, B group patients, and also O group blood patients? Obviously, because H antigen is a precursor of A and B. So H antigen will be present in all the three blood groups. Okay. Now, what if the patient is not having H antigen? Bombay blood group. That is called as Bombay blood group. Okay. Now, another one small antigen is present. We all heard of it. D antigen, which symbolizes whether the patient is Rh positive or Rh negative. So if the D antigen is present it is RH positive. It is absent, it is RH negative. RH positive patients can receive blood from RH positive and RH negative patients, whereas RH negative patients should not receive blood from RH positive patients. That is why when a mother is RH negative and the fetus is RH positive, there is going to be result in hemolysis. Right, this is the reason. Okay, so we have A antigen, B antigen, H antigen, D antigen. Now coming back to the question, which antigen is present in all the blood groups? Obviously it's going to be H antigen. Now coming back to the next question, identify the type of muscle shown here. So here it was smooth muscle. Okay, see, skeletal muscle, if you see, this is a skeletal muscle. Skeletal muscle has a lot of striations, you can see here, right? It has a lot of striations. It is a voluntary muscle. Okay, it is a voluntary muscle. It will have multiple nuclei, multiple peripheral nuclei. It will have striations. It will not have branches. Okay, it will not have branches or intercalated ducts. Okay, now coming back to the smooth muscle. Smooth muscle, if you see, it is present on the blood vessel, GIT, uterus, iris. Okay, so it is responsible for the constriction of the pupil during uterine contractions in labor. It is responsible for peristalsis. Okay, it controls the blood pressure, vasoconstriction. So smooth muscle is completely involuntary. Okay, smooth muscle is involuntary and it will not have striations, and it will have one single centrally present nucleus. Okay, it will have one large single centrally present nucleus. Okay, so it is completely involuntary, whereas skeletal muscle is voluntary. What is the function of a skeletal muscle? Obviously body movements and posture. What is the function of smooth muscle? As I told you, peristalsis or uterine contractions in labor, iris contractions, and also it is helpful for vasoconstriction, that is blood pressure regulation. Now cardiac muscle, if you see, cardiac muscle is involuntary and it has striations, and one very important feature of cardiac muscle is it has branches, intercalated ducts. Branching and intercalated ducts will be seen. Okay, so cardiac muscle function is pumping the blood. It is fatigue resistant. These muscles will never undergo fatigue, whereas on the other hand, the skeletal muscle is extremely fatigue sensitive. It will easily become fatigue. Okay, so in this situation they asked about a smooth muscle. So smooth muscle is a single non-striated involuntary muscle with a central large nucleus present. Okay, now moving on to the next question. In jugular venous pulse, A, C, and V waves are observed. C wave is due to. Okay. Now, before moving into this question, we have a very simple format of a jugular venous pulse. Okay. See, normally if you see, the heart, it mostly talks about the right atrium pressure. Okay. So this is the right atrium and this is the right ventricle. Okay, this is the right atrium and this is the right ventricle, and this is the tricuspid valve. Tricuspid valve. Okay, now okay, so what dilated structure is a tricuspid valve. So now imagine a blood enters the heart. The blood enters the right atrium. Okay, so see, say for example, so imagine this is the right atrium, this is the right ventricle. We have what is called as the tricuspid valve. These are all the semilunar valves. And if you look at the on top of it, okay, on top of it, the right atrium receives the blood from superior vena cava and inferior vena cava. one amazing thing is that these superior vena cava and inferior vena cava will not or does not have any kind of valves like tricuspid or seminal valves. Okay, so there is no valves here. So am I right in saying that whenever the right atrium compresses, contracts, okay, there is going to be some amount of backflow of blood into the superior vena cava and inferior vena cava. Why? Because there's no valves. So whenever there is a contraction of the right atrium, the blood backflows into the superior vena cava and inferior vena cava. So the atrial contraction that is causing the backflow of the blood into the superior vena cava and the inferior vena cava is going to result in the formation of A waves. Okay, that is going to result in the formation of A waves. Okay, now am I right in saying that whenever the right atrium contracts, there is some amount of blood will be pushed into the right ventricle as well? Okay, so some via the tricuspid valve, right? So this is what is going to result in A wave. So A wave is mainly because of the backflow of the blood because of the atrial contraction into the superior inferior vena cava. Okay, now that A wave is followed by the X, that is nothing but X descent. So whenever I say the word X, there is going to be atrial relaxation. So imagine the body is trying to compress, it is contracting, it is squeezing, and over a period of time it should relax, right? So once the atrium contracts, the blood goes into the superior vena cava, inferior vena cava, and also to the right ventricle, and then it relaxes. That relaxation point is called as a X descent. Now imagine the blood has entered into the right ventricle. Now the right ventricle starts to contract. So what happens when there is increased pressure in the right ventricle, because it is trying to contract, it is trying to squeeze, the tricuspid valve, it bulges and moves up. Why? Because I'm trying to push the valve with the help of pressure. Okay, so I'm pushing the valve by contracting the right ventricle, by contracting, and I'm trying to push the blood to the semilunar valves. Okay, so meanwhile the tricuspid valve becomes bulged, right? So that tricuspid valve bulge is what we see it as C wave. Okay, again, while this ventricle is contracting, atrium is still relaxing. Okay, it is still relaxing, it is still receiving the blood. Okay, now this relaxation is what is called as again X descent. Okay, so the tricuspid bulge takes place because of the ventricular contraction. At the same time, the atrium is still relaxing. That is why we see a X descent. Now we see a V wave followed by the X descent. V wave is because of the venous filling of the right atrium. Okay, so the blood starts to fill the right atrium. So because the ventricle is contracting, it has become smaller in size. The right atrium becomes bigger in size and occupies the space as the ventricle shortens. Okay, so it receives lots and lots and lots of blood from the superior vena cava. It becomes full. Okay, and then what happens over a period of time? It just puts the blood into the right ventricle, right? So that is what is called as the emptying into the right ventricle through the tricuspid valve. So this is the cycle it keeps on repeating. That is what we call it as Y wave. Okay, so A, atrial contraction, which is followed by the X descent, the atrial relaxation. C, tricuspid bulge, the ventricle contracts, pressure pushes the valve upwards. Again, the atrium is still relaxing, X descent, which is followed by the ventricle, when the venous pushes the blood outside through the semilunar valves. Meanwhile, the atrium fills the blood, venous filling takes place, it empties into the right ventricle through the tricuspid valve, and the cycle goes on. This is what is called as jugular venous pulse. So you can feel the pulse in the sternocleidomastoid muscle. Okay, because there is no valves, you can feel the pulse here. Okay, so coming back to the question, in JVP, ACV valves are observed. The C valve is due to tricuspid bulging. Okay, so the answer here will be the bulging of the tricuspid valve during the isovolumetric contraction phase. Okay, because of the ventricle contraction, there is going to be upward or bulging of the tricuspid valve. Now, what are the things you should read? Because I cannot explain everything here. Is you should read about what happens in atrial contraction, what happens in ventricular contraction, rapid ejection phase, slow ejection phase, rapid filling phase, slow filling phase. If you can read that, you will easily understand this. But as of now, I can give you a very basic concepts of what is JVP and what are the ways and why it is caused. Okay, so moving back to the next question. Wound healing is accelerated in. So basically, if you see, when we apply heat, there is going to be vasodilation. So when there is vasodilation, increased amount of blood, increased amount of blood, increased amount of leukocytes, and enzymatic activity is going to get increased, because of which there is going to be increased platelet for activation, and also there is going to be fibroblast activation, not platelet, unless and otherwise you are having an external wound. Obviously the platelet is going to get activated, and also because of all this, there is going to result in increased fibroblast activity, and there is going to result in collagen synthesis. Okay. Cut. Start. Now moving back to the next question. Wound healing is accelerated in. So wound healing, if you see, because it occurs, there's going to be a lot of reactions which is going to take place in the body. Imagine when I apply heat, there's going to be mild heat. Okay, there's going to be vasodilation, increased blood flow. So when there is increased blood flow, there's going to be increased leukocyte migration, platelet activation. So there's going to be increased fibroblast production, if you know the pathway of the inflammation. Okay, so whenever the wound occurs, there's going to be signals, pro-inflammatory cytokines, blood vessels, neutrophil migration, platelet activation. Platelet in turn going to produce growth factors, and it also activates fibroblast. Fibroblast in turn produces collagen. Collagen is responsible for wound healing. So wound healing is basically accelerated by hypothermia, mild hyperthermia. If there is anemia, obviously there is not going to be enough amount of oxygen. All this is going to get collapsed. In diabetes, microvascular disease, decreased leukocyte migration. Again, there is going to be decreased wound healing because the fibroblasts are not going to get activated. In hypoproteinemia, obviously the collagen is nothing but protein. So amino acids will be deficient, the collagen protection will not be there, the wound healing will be delayed. So these are all the straightforward factual questions. Wound healing is accelerated in mild hyperthermia. Okay. Moving on to the next question. Neurogenic shock is characterized by. So neurogenic shock is basically a distributive shock. Okay. And also it occurs in cases of spinal cord injury. Okay. So whenever the patient is having spinal cord injury, okay, there's going to be distributive shock. Okay, that is because of which there's going to result in neurogenic disturbances. Neurogenic disturbances. So see, when there is neurogenic shock, the sympathetic tone is going to get affected. Okay, so the sympathetic tone is mainly responsible for vasoconstriction. Sympathetic tone, parasympathetic tone. Sympathetic tone is mainly responsible for vasoconstriction. Okay, parasympathetic is responsible for hypotension, bradycardia. To be specific, bradycardia. So what happens when I'm having neurogenic shock? The sympathetic tone is going to get affected. So obviously I'm going to get vasodilation, hypotension. And also because the sympathetic tone are affected, the parasympathetic becomes free, which means it is unopposed. So when there is unopposed, my body is going to have more bradycardia. Okay, so there's going to be hypotension and bradycardia. So whenever the patient is having neurogenic shock, there's going to be distributive shock, the spinal cord injury, there's going to be affected sympathetic tone. Sympathetic tone is mainly responsible for peripheral vasoconstriction. So when it is affected, that is going to result in vasodilation, which is going to result in decreased blood pressure, which is going to cause hypotension. So when the parasympathetic tone, it naturally causes bradycardia. So the body tries to reverse it, but because there is no unopposed action, the sympathetic tone is affected, the patient is still going to have bradycardia. So there is going to be hypotension and bradycardia in patients with neurogenic shock. Now, moving on to the next question. Which of the following is not related to the respiratory centers? Okay. See, the respiratory centers is predominantly present in pons and medulla, right? Pons and medulla. So if you look at the dorsal and the ventral respiratory group, they are present in medulla. They control inspiration and expiration. Okay. Whereas the pneumotaxic center is located in the pons. That is a result in it controls the regulation of breathing. Okay. Regulation and pattern of breathing. Okay. Whereas the caudal ventrolateral medulla, it regulates the cardiac function. Okay. And not related to respiratory centers. So which of the following is not related to the respiratory center? It's caudal ventrolateral medulla because it controls the cardiac regulations and not the respiratory. Whereas the respiratory centers are located in the pons and the medulla, the dorsal and the ventral respiratory groups, they control the inspiration and the expiration. The pneumotaxic center is located in the pons, it regulates the pattern of the breathing. Okay. Moving on to the next question. What is tripled response? So tripled response, if you see, when I take an instrument or when I take any kind of an object and try to scratch my skin, there will be redness, there will be spreading of the redness, and also there will be swelling of the area. So it becomes red, it spreads, it swellens. Okay, Lewis, that is red flare wheel reaction. Okay, so the red line, okay, so the red line is because of the capillary vasodilatation. Capillary vasodilatation. And the flare reaction. What is flare? Spread. Okay, it is because of arteriolar vasodilatation. And the wheel is nothing but edema. Edema is because of increased vascular permeability. Okay, so when I take this is a Lewis reaction, the red line, flare, and the wheel reaction. Okay, so when I take a instrument and rub it over my skin, I going to get red line, flare, and wheel reaction. So capillary vasodilatation, arteriolar vasodilatation, and increased vascular permeability. This is what you're going to get when you see a tripled response. Okay.